It's just a huge honor for me today to be podcast interviewing Jill Meyer-Lippert, RDH from Manitowoc, Wisconsin. She began her dental career in 1992 as a dental assistant and receptionist. At the same time, her mother was diagnosed with breast cancer. Helplessly watching her mother suffer horribly with oral side effects from chemotherapy, she developed a strong interest in the oral concerns of cancer survivors. Jill earned her degree and became licensed as a registered dental hygienist in '94 and continued to pursue knowledge to help this very underserved area of cancer care. After losing her father to Hodgkin's disease in 2005, she developed an enhanced level of motivation to act and do more. Jill created a volunteer program providing oral care kits with product samples and patient education at a local oncology department from 2006 to 2012. She earned a certificate in oncology management from the University of Southern Indiana. Jill and her husband are the owners of SideEffectSupport.com, which is dedicated to helping cancer survivors manage short-term oral side effects and prevent long-term damage to oral health associated with chemotherapy, radiation to the head and neck, and some targeted therapies. Jill is a 2014 recipient of the Sunstar Americas RDH Award of Distinction, a member of the Registered Dental Hygienist Advisory Board for the Oral Cancer Foundation, and has been published in several dental and oncology publications. She is a member of the American Academy of Dental Hygiene, the American Dental Hygiene Association, and the American Academy of Dental Oncology. Jill, thanks so much for coming on the show today.
Thank you for inviting me.
This is so tell us what are you doing at SideEffectSupport.com? If people go to that website right now, what are they going to find?
They're going to find information. We have articles, blog posts that are directed more towards survivors and their family caregivers, but then we also have more technical information for medical and dental professionals to help get us more on the same page. And then there's also a product section that they can find very affordable products that are geared towards helping to minimize some of the symptoms and side effects and also protect long-term oral health in the process.
So I see you got a lot of amazing resources, links to the National Cancer Institute on oral complications of chemotherapy and head and neck radiation. It's just what do you think the average dentist and hygienist are not staying on top of that they need to know more of?
There's quite a bit. It's a very complex subject matter, and with everything else that we're doing and dealing with during our daily process of seeing patients, this is something that tends to get lost in the shuffle in our education, and it's hard to stay up on top of all of these things because it is such a complex subject. So one of my goals was to really make kind of a one-stop shopping resource for people, because that is something when I developed a passion for the subject, I really struggled to find information and resources. So I wanted to create something to make it a little easier for people to find what they need.
Well, you know, the chemotherapies all came from the fact that when they were learning how to make mustard gases for wars, they realized that the cells that were dividing quickly and had a high turnover, those were the ones susceptible to it. But a cell that wasn't multiplying was not. And so that's kind of tough for the mouth because the cells in the mouth have some of the highest turnover, especially if you compare it to a bone or nerve. So
exactly,
that's a so how do they how do they help alleviate some of those symptoms?
One of the biggest things we can do, and unfortunately it's one of our greatest battles, is getting patients in very early, very soon after diagnosis, before treatments begin, allows us to be very proactive, that we can remove irritations in the mouth and get them started on some preventive strategies that will help to reduce the incidence and the severity of side effects. It may not totally prevent them, but at least it may help to keep more of a quality of life for them and reduce their risks of infection before or during the process, and also help to reduce those long-term damage issues into survivorship.
And are these mouthwashes treating just dryness? I mean, a lot of the chemo people get fungus infections, candida. What are you seeing as the most common side effect that you can help them with?
Dry mouth is a big one, and the nice thing is we have so many patients with dry mouth that even aren't necessarily in oncology situations that these are also helpful for them. But if you deal with the dry mouth effectively and not just mask the issues, you're going to be actually helping to prevent a lot of other problems like the oral mucositis, because it helps to lubricate the tissues. And, there's even to avoid the fungal infections and things like that. The drier people's mouths are, the more susceptible they are to the problems. So the only prescription product that there is available on our site is the Saliva Max and Saliva Cane, but everything else is just affordable over-the-counter products that are have a healthy pH and void of irritating detergents that may cause complications, irritations in the mouth. Extra soft toothbrushes. Sometimes they're really just simple changes that can make a big difference for people.
And tell us about Saliva Max. You need a prescription for that. Are you a big fan of that?
Yeah, I think the supersaturated calcium phosphate rinses are a great option for people. And that also, if you can start that, about 2 weeks before treatments begin, they've proven to reduce the incidence and the severity of developing the dry mouth and the oral mucositis. So it's a great preventive option, and also it's really replenishing those natural elements of healthy saliva that's missing in a dry mouth with having the calcium and the phosphate that our teeth are dependent on for remineralization and our tissues dependent on for healing properly.
And how long has that been on the market? It's Forward Science makes that, correct?
Yes.
It says
I would say
go ahead.
About 4 years or so.
4 years, and is that your go-to treatment for dry mouth?
If we're able to get people started on that early, I think that's a great option for them. We do have some people that, whether it be financial issues or lack of insurance coverage, that they choose not to go that route. At least we do have some over-the-counter options that they can try as well. It's kind of depending on that individual person's situation.
Is it pretty expensive?
No, and they actually have a copay assistance program. So if there is insurance coverage through the prescription insurance plan, Forward Science can help to reduce or possibly eliminate the copayment.
Forward Science, it says on that they're a proud producer of Oral ID, CYT ID, Path ID, HPV ID, pH ID, and Saliva Max. You just
Yes.
mentioned Saliva Max. Do you ever have an indication for all the other ones?
Yes, the other aspects are actually for screening for oral abnormalities. So all of those other devices and products are part of their ID for Life program. And that is part of your early detection for oral cancers, oral abnormalities with the fluorescence. And then the more advanced testing kits, like the Site ID is actually a liquid cytology. So if you would see a suspicious lesion, and you can take some of those surface cells, send them into a laboratory, and have a report sent back to know if it's something that needs to be looked at further.
And that's where's that? That is Forward Sciences. That's in Stafford, Texas.
Yes.
Forward Science. So do you work with the CEO Robert Whitman on that?
Yeah, so we've known Rob for many years.
Yeah, and Brian Picula.
Yeah. Yeah, it's a great company, great group of people working there.
Huh, I mean, that is they got a lot of things going on. So what you also have moisten mist, you have lozenges, you have all kinds of products on dry mouth. What makes you use one product versus the other?
Sometimes it is just a very individual situation. And like I said, there's really no one size fits all. I wish there was a magic bullet that worked perfectly for everybody. But I have many patients that have issues and just swear by a certain product, and the next person tries it and maybe doesn't have as good of a result with it. So sometimes treating these issues is a little bit of trial and error. So you can try one thing, and if it doesn't work, you go on to the next, and eventually you find the right fit for that person.
And you sit on the board with the oralcancerfoundation.org. What is that like?
It's a newly formed dental hygiene advisory board, and it's really focusing on helping to get the word out there and promote early detection and promote what the Oral Cancer Foundation is doing, because they are a really nice organization that does a lot of great things in the terms of research and raising awareness and promoting early detection for oral cancers.
Huh. And how, it's tough in dentistry because you have to wear so many hats. I mean, you got to learn how to do root canals, fillings, and crowns. You got to be a leader at HR, advertising, market, everything. And I've always noticed that if you don't see a case every week, if you don't do a filling every week or a crown or an implant, if you do it 52 times a year, you can get really fast, high quality, profitable. The problem with oral cancer is they don't see it that cancer patients. It's just not that common. Or do you think it is more common? Like in a dental office right now today, there's 150,000 general dental practices. How often do you think they see a cancer patient that is having these side effects?
It would be a hard number to guess, but not only thinking of people that are actively going through treatments now, but every week we're seeing people who are cancer survivors. So being aware of what type of treatments they had, what type of side effects go along with those treatments, and being able to deal with those into survivorship is also a part of this. So in the ideal world, we would see people preventively before they start treatments, be able to be very proactive to help reduce the problems, be there for them during the process if problems arise, but then also be their support structure, into survivorship and understand what some of the damage is that can happen and what we can do for them.
And then where are you say that you have online articles for the dentist or the patient. So where are those at on your
there's a blogs tab
under resources for survivors and caregivers?
Actually, there's a blogs tab on top.
Oh, okay.
And if you click on that,
yep,
you can separate those from the survivor caregivers that are more in layman's terms, and then the professionals, medical dental professionals that are more technical.
I love the Anti-Cancer Club. It's about life. That is really amazing. So are you getting a lot of positive feedback from survivors that are using this website and articles and products?
Yes. It was tough to get the word out there at first, and tough for me to have people understand what it was about, because I think that assumption was mostly that it was only oral cancers, that they may not be presented with these cases often enough. So as people are understanding more that it's all types of cancers, all types of treatments, and it is a very universal problem. And when you talk to so many survivors that tell you their stories about the lack of information that they received, that they had problems during the process, that they weren't told ahead of time what they may experience. They weren't told what they could do to prevent it. And being so grateful when they actually have something that helps them.
You also have articles from the American Academy of Dental Oncology.
Yeah, that is a organization that really isn't connected so much anymore. But I was very, very fortunate to go down with Dennis Abbott in Texas. He was one of our instructors there, our main instructor and the organizer of the academy. And I was one of the only hygienists in the country that was part of that inaugural meeting. And it was very exciting, very instructive, a lot of great people that all had similar interests. So it was a really great experience being a part of that.
And that was with Dr. Abbott?
Yes.
Dennis Abbott. That's so what's he doing down there?
He actually specializes with dental oncology. So he's spoken all over the country, teaching other dentists about things that they can do in regards to cancer, treating our patients going through cancer, some of the same types of interests that I have. So it was really like finding a kindred spirit when I found him online.
Oh, that's awesome. The internet is very, very cool.
It is.
So what else are they going to find on sideeffectsupport.com?
Just those resources, the information, the products, and having that support structure or the support system. That I have a lot of patients that email me personally a lot, that they have questions about now I might be dealing with this, or now I might be dealing with that. Do you have any suggestions? And they go back to their support groups and they bring information for their other friends and their other people that are dealing with the same types of problems. So it's really awesome to see kind of how it's spreading from word of mouth from the patients, and trying to help each other through it all.
Is it more professional or more consumer on your site?
Both, actually. We're just starting a bulk section that is going to be designed for providing products for clinics, hospitals, long-term care facilities. So we have one product on there at this time, and I would like to grow that, obviously, to have more options.
So I've also noticed I follow you on Twitter. Your Twitter is oh my gosh, what are you on Twitter? What's your Twitter?
At support Jill.
At support_Jill, isn't it?
Yes.
Yeah. That newspapers have picked up on your articles. Yeah. So it's at support_Jill. I noticed the Green Bay. You're only a half an hour away from Green Bay.
Yeah.
So you've gotten some community press with that. Congratulations on that.
Thank you. Yeah, it's I went to some of the SCORE meetings, which is basically like a small business advisory group, and they helped kind of get things started for me. And yeah, they've gotten some good progress or good exposure with some of those things.
Good exposure. What has been the most help in growing this website and this business, sideeffectsupport.com?
Well, I think being one of the recipients for the RDH Award of Distinction was much larger than I had imagined it to be at the time. I really didn't understand what that award was when I was a recipient, but the connections and the community that it has brought it has been wonderful. So I've met so many great people, and it just continues to blossom from there. A lot of just networking and finding people with similar interests and that entrepreneurial spirit that really everybody wants to help each other. So it's a great group of people out there.
So that's the Sunstar Americas Award, Sunstar Americas RDH Award of Distinction?
Yes.
And that was, you said, larger than life for you. How so is that? Tell us more about that award and how that got you so much attention.
They give the award at RDH Under One Roof. And the year that I was a recipient, we had 8 of us that were chosen. They have since narrowed it down to 4 people each year that they choose as award recipients. But they just form a really awesome community where it is meant to support each other and in your endeavors, and to recognize hygienists that are doing something unusual, that are going above and beyond typical clinical work.
Well, congratulations to that. That's just awesome. Yeah, that RDH Under One Roof, that is the main event in dental hygiene every year. Would you agree?
It is a great event.
Yeah, I think
definitely would recommend anybody going.
It's what?
I definitely would recommend.
Do you go every year?
Attending. Oh, I wish I could. I would love to go every year, but it's a little limited right now. But I'm able to get away to do that. But
so do you
I
make
hope to in the future?
Do you make any of these products, or are you just a one-stop shop resource for all these products?
Basically, it's distributor, one-stop shop. There is one product that is fairly exclusive to us. That's the lip balm. It is made from, actually, my cousin is a beekeeper here in Wisconsin, and she makes products from her bees, and that is one of the products that we have. So it's petroleum-free and free of other harsh chemicals that may cause irritation.
That's the nourishing lip balm?
Yep.
Wow, that is amazing. So now, is it all virtual online, or do you actually have to warehouse product and put it in a box and ship it?
Yes, I am. I'm like Bill Gates building a computer in his garage. I have a bedroom that is converted into an office and a storeroom. I am physically packaging and mailing out orders and doing. Sometimes my kitchen table is just filled with packaging supplies and boxes and and products, just getting everything together.
So you've been doing this since 2012 to 2019. So you've been doing it 7 years. Is this a growing business?
It is. It is, and it seems like this last year has really been a year that it's starting to take off more.
And what do you attribute that to?
I think it's just more of awareness, maybe, and people understanding better what a need there is. That seemed to be hard to get through to people at first, really understanding why this was a need.
Yeah, I also see that you're a burst ambassador. Talk about that. Why are you a burst ambassador?
I love that toothbrush. I was a Sonicare fan for many, many years. The burst for me is something that, while people are going through treatments, a mechanical brush may not be the best option for everybody, but when they are ready for a mechanical brush, it has extremely soft bristles. They're very feathery. It's got three modes of a setting. So it has like a sensitivity setting. So it doesn't have, the real intense vibrations. It has like an antibacterial quality to the bristles. And if you put too much pressure on the head, like if you get up to a tight spot in your mouth and you put too much pressure on it, it'll actually shut down the motor a bit. So you're going to minimize your risk for having tissue trauma by using it.
There's really been a lot of innovations in toothbrush lately. I mean, they've connected electric toothbrushes to the smartphone. There's burst, there's quip, there's all kinds of it. Made of bamboo shoots for disposable. It's just a huge market because there's 7.5 billion sapiens living on the surface of Earth, and they all should be brushing their teeth twice a day and throwing it away every 3 months. I mean, if you do the math on that, if anybody just got 1% of the toothbrush market, it would be a major company. I remember when Bob Ibsen, the founder of Denmat, he didn't like any of the toothpastes. He thought they were all just generic, and he wanted to have a high-end toothpaste, Rembrandt, for composites. And I remember him telling me, he says, this market's so huge, if I just got 1% of it, it'd be the biggest thing I did. And he did, and it went on. But as you were saying earlier, that everybody's different, everybody likes different stuff. Are you having success with Burst toothbrushes, burstoralcare.com?
Yes. I found that my excitement for it, it was the Christmas gift of the year in my family. Every single family member I have, I think, has gotten a Burst toothbrush from us. But it's really a quality toothbrush. I think it does a great job with keeping down the bacterial burden inside of the mouth. And it's a good seller. It's a really great product.
And you have a lot of interesting. People should go there just to look at all these products. You have a lot of interesting products, like AuraChill. What is AuraChill, and why is that on your site?
That is actually like a cryotherapy type of a device for the mouth. So some people, if they have tissue irritation, soreness inside of their mouth, rather than having a drug to try to fix that problem, they can use cold items to try to reduce some of that swelling or tenderness inside of their mouth. And actually, when people have chemotherapy treatments done, one of the ways of helping to prevent getting mouth sores is by sucking on like ice chips or something cold. And the concept is that it shrinks the blood vessels in your mouth or constricts them. And then it prevents the same amount of chemotherapy from reaching those tissues to contribute to oral ulcerations. So the cryo, the OraChill can help to do that same type of a cold cryotherapy for the tissue.
And that's Joey Santoro out of Sacramento?
Yes.
And how's that product doing?
Good. We're more of a kind of a resource that we don't carry it directly on our site, but Joey's had a lot of cancer in his family. He's lost a lot of people close to him through cancer, so it is a subject that's really near and dear to his heart. And he's extremely generous that if people are going through treatments, he often offers his product for free for them, because for him, it's more important that they get the help that they need.
And that seems like your motivation too. This hit really close to home, losing your father to Hodgkin's and your mother had breast cancer. Do you see that a lot in the oncology space?
Yes, I see that a lot, that most people that are involved in it in some aspect is usually because they've been touched by it personally. They've seen it firsthand and they want to make a difference for others.
You also you just have a lot of there's so many amazing studies, all kinds of products. Another one is an oral ID, Shine Light, Save Lives.
Yes, and that's with Forward Science as well. That's part of their ID for Life program. The oral ID is a fluorescent device that helps with early detection for oral abnormalities, oral cancers when we're doing our screenings in the office. And the other products that go along with it are like the Site ID, the Path ID, the HPV ID, and those are all adjunctive tests that can be used to help with diagnosis.
I always found it bizarre how, you go to the other end of the body on a female and these lights and types for pap smear screenings, and they had the UV lights and the toluidine blue stains and all that kind of stuff, and it was all paid for by medical insurance, and it was just the go-to. And then we're over here in dentistry, and it's like insurances don't want to bill for that stuff, and it's like 50,000 Americans drop dead from oral cancer every year, correct? Is that the number? 50,000.
Yes, this year.
And
they're thinking about 50,000. Yeah.
And could you imagine the outrage if the medical community told women, "Oh, we're not going to cover the pap smears and the toluidine blue and the purple light," and I mean the women would go crazy. But then the other end of the mouth, men and women, it's just so. It's one of the huge side effects of dentistry breaking off from medicine. And what do you think of the typical dental insurance billing for oral cancer screenings, oral cancer exams? Like you're talking about this this Forward Science with the oral ID. I mean, almost none of that has an insurance code. Is that correct?
For some of them, there can be some codes used. There is a code for using that adjunctive fluorescent device. Whether it's going to be covered or not, probably not. But not all offices charge for that either.
But do you think it's bizarre that 50,000 people dying from oral cancer, it's treated,
absolutely.
And it's just this lame attempt to go after it and subsidize any technologies, because money matters. I mean, money is the answer. What's the question? You can't do all these things with unicorns and tooth fairies. It takes cash. And a lot of I watched it for 30 years, a lot of these oral cancer companies coming out with all kinds of technologies, they were assuming the dentists would take it as serious as like OBGYN, but there's just no financial support for it.
Correct. It's one of those things that we battle all the time, that thinking that the mouth is somehow not connected to the rest of the body. And I think that's part of so much with side effect support, that people aren't getting that information, the support they need, because whatever's happening in their mouth, the physicians aren't making that connection, what effect that has on the rest of their body and their medical conditions. But yes, it's very sad that there's so many people out there that are being affected by oral cancers, and the numbers are rising. They're not going away. They're not getting smaller through the years. Cases of oral cancers are growing, and it's something that the dental industry has to very much take seriously, to make sure that we're screening properly, and if there is something, starting to catch it at the earliest stages.
And we're seeing some interesting statistics that at my age of 56, I never thought I would see. Like life expectancy pretty much always went up every year, and for the United States, and then it's gone down the last 2 or 3 years. And some of these cancers, I just always assumed when I was in college that there would just be less, that they would just go down every year with more and more knowledge and technology. But smoking was one that shocked me. Smoking bottomed out a couple of years ago. And now smoking is coming back up, and they attribute a lot of that because of vaping and all kinds of things. So oral cancer is gonna be here a long time.
It is, and the highest growing demographic is not typical of what we were used to through the years. It's now the younger non-smoking males because of the human papillomavirus. So we may see a trend changing with that as more young boys start getting vaccinated along with all the young girls, because there was such a push for the young females to be vaccinated, but now they're also trying to get more young males vaccinated. So hopefully as time goes on, the more vaccinations that occur, the fewer cases we'll start seeing with some of these oral cancers as well.
And this anti-vax movement doesn't surprise me at all, because I was the dentist with Jack Dillenberg that got Phoenix fluoridated in '89, and I mean, it was like 1/4 of all Arizona people. They just had the most insane theories about communist plots and big government and one world government, and so the people are the same. I can't believe it's 2019. And now we're having measles outbreaks and anti-vaxxers. Yes. You're talking about an HPV vaccine. I mean, there's just a good solid. I think it's about 1 in 5 Americans are completely batshit crazy. I can't believe we'd be seeing the measles outbreaks. I mean, diseases that should have just been gone. Yeah. And this HPV. I mean, I'm embarrassed of my homies where when this HPV association with oral and pharyngeal cancer came out, hardly any dental offices are talking about this to parents. I mean, it's more important to the hygienist and the dentist to get in there and do the prophy and cleaning and do all of that. And it's like, my gosh, this kid's 12. I mean, wouldn't it have been better to give them a flu shot? But they can't legally give them a flu shot, but they can walk across the street to Walgreens and have a non-pharmacist tech give a flu shot. And the flu can kill 30 to 80,000 Americans each year. The HPV vaccine. I mean, why do you think dentistry isn't staying on top of flu shots, HPV vaccines? I mean, you have a 4-year degree. That's a registered nurse in any hospital in America where they're giving shots all day long for that stuff. Why do you think the culture is so vastly different?
That is a hard one to explain. Yeah, and I think there is just such a disconnect in our patients' minds, and unfortunately that goes over into the professionals' minds as well. That that. It's not even on the radar, I think, for a lot of dental professionals to be even thinking about that. But that is the one nice thing that I really like with Forward Science as well, is that they offer great information that we can provide to our patients that talks about HPV. So, I still practice, and it's something I try to do pretty consistently. When I get kids in 10, 11, 12 years old, I have a pamphlet I can hand them and talk about, to mom and dad, this is information for you, that if your pediatrician has not already talked to you about the HPV vaccine, ask them about it. give them some background on it and be proactive on our end. So even if we can't be the one that's administering the vaccination, we can at least inform them about it and encourage a conversation with their pediatrician.
Well, I mean, last year, 2018, the flu winter of 2018, 80,000 Americans died of the flu, including 180 babies, children, and teenagers, more than any year since they started tracking pediatric deaths. And it's like, and still, a pharmacy tech with 9 months of school across the street from my office at Walgreens can give me these shots. And the dental office, I mean, we legally can't even do it. I mean, it's just really bizarre. And with 50,000 oral cancer deaths and having a technology, the HPV vaccine, you would think access to health, that a flu shot and an HPV vaccine would be far more important than determining if they had 5 cavities and gingivitis.
Yeah, and I guess you never know where how that tide may turn through times, because I think a lot of that anti-vaccination mindset comes from not believing it's real. We've never had to deal with measles, growing up, so it wasn't real to us. So until, unfortunately, people start to see these personal experiences of people being affected by it, I think all of a sudden we're probably going to start seeing a trend going the other way again, that they'll understand the importance of it.
I mean, to put that in perspective, the bubonic plague killed a third of Europe, and it took Europe 200 years to regain its pre-plague population. And
Yep.
what's the answer to that? I'm against vaccines. I mean, it's just people are they're so impossible. You're very close to Canada. What % of your business, of your shipping, is America only versus Canada or other countries?
We've been staying America only at this point. As we grow more, there might be some other opportunities, especially if we go look at the bulk end of options for facilities, for hospitals, things like that. But right now with shipping, even though that we are so close, it still is, it makes it hard to do.
So when you, what do you ship mostly? UPS, FedEx?
Usually the postal service.
And it's significantly more expensive to ship across the border into Canada?
The few times that I've done it, yes.
Wow, that seems like such a 90% of the Canadian population lives within 100 miles of the U.S. border. You would think that would not be an issue. I noticed that one of your products you sell is Closest, which is in my backyard with Perry Radcliffe.
Yep.
Started that. I remember going to dinner with Perry, 3 decades ago. Getting a bottle of that. It used to be called Retardant before it was Closest. Do you remember that?
No, I don't remember that.
Yeah, it was first called Retardant, and then they changed the name to Closest. So, are you? What do you think of Closest?
I like it. I think that product line is very gentle. It's void of so many irritating detergents and other chemicals that really help to initiate some of that tenderness of the tissue, or may help to result in some of the oral ulcerations and things like that.
So you do like it then? Yeah, so
absolutely.
His Perry was a periodontist, and he was good buddies with Omar Reed, all here in Phoenix. And now his son, James Radcliffe, runs Ropar Pharmaceuticals, maker Closest. He was on the show. He was show 484. But yeah, Perry also was, I don't know why we don't do it anymore, but in his office, he would always take a swab of saliva and put it underneath the scope. And, then,
okay.
and it was just so, the teaching was so impactful because, back then in the 80s, I mean, you had to explain what gum disease was to people. I mean, they just, and there were just so many people that just could not believe that was in their mouth. I still think it's one of the biggest blasts from the past that we have to bring back. I think putting your saliva under a scope and letting them see the zoo of the San Diego Zoo of what's going on in your mouth. Now, we've been talking a lot about this oral cancer, but dry mouth is probably a lot more common outside of oral cancer, especially with polyphagia. When people are taking 5 or more prescription medications, it seems like everything gets out of whack. And so are you doing a lot of this for pharmaceutical-induced xerostomia?
Yes, I've really found quite a few patients that really aren't even oncology situations, but they've been struggling because of different medications, different medical conditions that they have with their dry mouth. And of course, the drier your mouth is, it becomes more acidic. It throws off that whole bacterial balance inside of your mouth. And unfortunately, there are a lot of products that are out in the market that are marketed to people with dry mouth, and they are damaging to oral health. They're acidic. Some of them have other irritating detergents in them, so they're really not good choices for especially people in oncology situations. So that was one of the goals with choosing products, were things that were not only going to mask the symptoms, but benefit oral health and be very soothing to the tissue altogether.
You also got a link on your website to Oral Cancer Consulting LLC.
Yes. That is one of my hygienist friends, Susan Cotton. She is on the advisory board with me for the Oral Cancer Foundation, and she is a great advocate for oral cancers, for early detection, and for training dental professionals how to do a proper, thorough screening. Because that is something that really tends to get lost in the shuffle in a lot of our appointments.
And she calls that screening the Cotton method?
Yes.
And tell us about the Cotton method.
She goes through just a very systematic approach of what we should be looking for, the proper ways of doing it to get the best visualization, the proper ways of documenting, and creating office protocols to make sure that your whole staff is on the same page for doing it consistently.
And what is her first name? It's Cotton, you say, is her last name?
Yes, Susan Cotton.
Susan Cotton. And so how can you educate more dentists and hygienists how to do all this? I mean, have you made like an online CE course, or have you tried to summarize this faster, easier?
I will be working on an online CE course in the near future, and I do in-person presentations. So I go to a lot of dental offices, and I'll do full staff trainings. I will speak at different conferences or meetings for maybe like the Oncology Nursing Society or a dental study club for dentists or hygienists, and it just helps to get the word out, to educate and put some of those key informative pieces in the back of their mind. So when the time comes at their situations, they know where to go and how to approach it.
Huh. Well, if you ever want to make an online CE course on Dental Town, that would be an option. We've put up 400 one-hour courses, and they've been viewed almost 1 million times because I think it's just so much more convenient to watch something an hour at a time instead of committing the whole day, flying somewhere. I think the human mind is about an hour is about enough. I mean, that's how long I do my show, because that's their hour commute. But I think humans learning an hour at a time is just a lot better. And a lot of the studies that I see in education are frightening. I mean, I've seen studies that show that when kids go to grammar school, they can remember nothing long term before 10 a.m. And then when they're listening to the teacher talk, they can only listen and comprehend for 7.5 to 15 minutes, and then they need a break, a nap, they need to go eat. I mean, that's all you got with the sapient mind. I mean, that's just the nature of it. So online courses are something that you're thinking about doing in the future?
Yes, the opportunity has been approached to me, and I'd like to. It's one of those new aspects that I will be going into, but definitely I would love to do that with Dental Town. And the nice thing is this is such a complex issue that there would be a potential of having several courses just focusing on dental oncology.
So would you just focus on dental oncology, or would you focus on xerostomia too?
Well, and all of that is part of it. Part of it talking about what types of side effects, why they have the side effects. It's so involved that just going into dry mouth in itself is a very complex subject, and talking about why it happens in oncology or what we can do about it. And that's only one aspect of what possible side effects can occur.
You also cover toothpaste. What toothpaste do you think are better for dry mouth and versus others?
The ones that we chose on our website, we do the closest, and then I have two types from the Squiggle toothpaste. The things that really attracted me to these toothpastes were the lack of irritating detergents. They're very, very mild. A lot of problems that we'll complain about is that a lot of toothpaste, the taste is too sharp. It'll burn their tissue. It'll sometimes aggravate nausea, things like that. So these toothpastes are very, very mild, but they're pleasant. They're not watery like some of the dry mouth toothpastes are out on the market, and they just have a lot of benefits to oral health.
And it has a lot of xylitol in it.
Yes. Yeah, I'm a fan of xylitol. I think that's a great product to help stimulate saliva, gives a pleasant taste, and it helps to keep that healthy bacterial balance inside of the mouth.
And who's the makers of Squiggle?
Squiggle is a company that's out east. And
just squiggle.com?
His name is Dr. Cutler. Yes, his name is Dr. Cutler.
And is he a dentist?
I believe he is a pharmacist, maybe. Can't remember exactly what his background was, but he's been very passionate and really, it was a great fit for us because when I told him what our mission was with side effect support, he was very excited because that was really something that he had been trying to squiggle into in oncology settings for quite a long time because he really has seen the benefits that people have had with using it with oral irritations.
Dr. Edward Cutler in Narberth, Pennsylvania.
Yes.
It's amazing. It's amazing how the long tail is, the millennials made the long tail. When the baby boomers were little, you had 3 TV stations. You had ABC, NBC, CBS. You had just a couple of radio stations in each city, and the radio station would be half commercials, half songs. So you'd have 6 3-minute songs and then 30 minutes of commercials. So you had all these stars that would sell 10 million albums, whether it be the Beatles or Elvis Presley or all that kind of stuff. And then the digital world came out, and instead of having 3 television channels, ABC, CBS, NBC, you had cable, which has 1,000 channels, and you have digital, and you have the internet. So whereas like Americans, the baby boomers would have buy one big album by the Rolling Stones or the Beatles or whatever, and everybody buy like American cheese and Velveeta cheese. All those products have plummeted, but the long tail of individual products is going out. I mean, Amazon reports that no matter what book they put on their shelf, they'll sell 1 unit of it every quarter. Same thing with iTunes on the songs. I mean, you could put a song on iTunes from a Tibetan monk who filmed it in a cave on her iPhone, and it would sell 1 song a quarter. And I'm looking at some of these toothpaste, like the Squiggle says it's vegan, free of gluten, dairy, and soy. That just wasn't a market for baby boomers 20 years ago. I mean, 30 years ago, you had Crest or Colgate or get out of town. And this is that long tail where we're probably going to have 100 different toothpaste and 100 different mouthwashes, probably selling to a huge, probably a third or a half the market. So I would only expect Crest and Colgate and Procter & Gamble, they're never going to see the glory days that they did when they could control all the commercials on ABC, CBS, and NBC. I mean, these big box brands are going to get replaced by the long tail. And I just think that's amazing. I mean, I just couldn't imagine thinking that being a vegan was associated with the toothpaste, but it obviously is.
Right. Yes. And I think for, this demographic, that they are so susceptible to that tissue irritation, that anything that we can do to help, keep that quality of life for them and keep them comfortable during the process, and just be void of some of those triggers, like I never thought about gluten being an issue either in toothpaste. But for people that do have those sensitivities, if they have a certain chemical in a toothpaste, that might just be the trigger that starts with the ulcerations and that tenderness that starts a snowball effect, where then they have a hard time brushing, and then we do get the plaque buildup and makes them more susceptible to infections and complications with their treatments in general.
Yeah, and we also live under this false bias that we know so much. I don't think humans want to realize that they probably don't even know 1% of all the knowledge in the universe. And so much of this stuff you just don't know, and you just got to listen to people. I mean, when someone's telling you, when I use this toothpaste, I get canker sores, well, who are you to sit on your pulpit and say that's crazy, or there's no research, or I don't even know if they know what causes canker sores, and who's to say that everybody's canker sores are caused by the same thing. So trying these different trial and error, that's the art of dentistry. It's an art and a science, and then also there's trying to find something that the patient will like. Some patients,
yes.
I notice a lot of the old baby boomers, they love Listerine mostly because it burns their eyes and burns their mouth.
Yes.
So they
you really think it's doing something.
Yeah, it's got to be doing something. It almost killed me. My mouth's on fire. How could a germ or a bug live through that? So this long tail in toothbrushes and toothpaste and mouthwashes, I find very, very interesting. When you started this, what products really surprised you in popularity? What did you start carrying and shipping a lot of that caught you by surprise?
I think I was surprised how popular the spry gum and the spry gems and mints are. I thought that was going to be something that would just be a nice thing to carry, because obviously when you're chewing and you're sucking on these products, it is helping to stimulate saliva, and it's got the xylitol to help also stimulate saliva and give you that healthy bacterial balance. But I was surprised how many people swear by those with helping with their dry mouth symptoms, much more than I thought they would. And when you talk about, the newer developments in certain products and their ingredients, I think that's where I'm really excited about the newest additions that we had with the Moisten and the Synodent. Those are made by Persina, and they've got a really unique combination of chitosan and arginine. So the arginine is an amino acid that will feed the good bacteria in your mouth. So it's kind of getting away from that concept of the past of Listerine, where you want to just get in there and kill everything, because as everything starts to recolonize, what is preventing all of the bad bacteria from overtaking the good one is recolonizing. But if you can concentrate more on feeding that good bacteria and overpowering the bad with that, the arginine comes into play, the chitosan, it helps to maintain a stable pH in the mouth, and it's anti-inflammatory. And it's got a really great potential, I think, with that combination of those two.
And that's Blaine, it's clear with an X, Xlear, Blaine Yates out of American Fork, Utah. Do you work with him very much?
I don't know him personally. I just know the people that the reps that I deal with, but they also are a great company to work with. I've been very pleased with some of the updates that they've made and some of their products through time. And Persina is actually out of California. That's with the Synodent and the Moisten. I can't say enough about their company. I've been very, very blessed to make a lot of great contacts.
And that's Syntident, you said? That's one of the...
the Synodent and Moisten, comes in a rinse and a spray.
That's a mouth rinse?
They have a rinse and a spray, or what they call a mist.
Oh, Synodent, here it is, okay.
Mm-hmm. But with the Moisten, they've actually found through studies that it can raise resting salivary rate.
Huh. And that's made by the company Prisna?
Prisna, yep.
Prisna. And how long have you been aware of Prisna? That's a new one to me.
I would say maybe 6 months or so. We haven't had it on our site that long, but I really can't say enough about the products so far and the company. They're fabulous to work with.
Huh. Any other surprises?
Trying to think of what. I really enjoy the Zollipops. As an adult, I probably shouldn't enjoy lollipops as much as I do, but they are such a neat product. And that is one that I'm hoping to actually add to a bulk section at some point, because a lot of oncology departments they may provide things for their patients to suck on during chemotherapy infusions to help stimulate saliva. And sometimes they can get that bad taste in their mouth. So it's just a nice thing that they try to do for them. But many times they're giving them, Jolly Ranchers or lemon drops or things that really could cause a lot of damage to oral health, down the line. So I would love to offer some other options that they can provide for their patients that taste good, they can stimulate the saliva, and offer them some oral health protection in the process.
Huh, that is amazing. Is there any other thing that you wanted to talk about today that I didn't cover? I've been all over the board with all these different products and companies. What is there anything else?
I just hope that, I'm grateful to have this opportunity to make more people aware of the services that we offer through side effect support, and then also just to encourage dental offices to use it as a reference for their patients. So when you have your patients with dry mouth, that you have some place that you can direct them to get these products. Because unfortunately, when you make recommendations for products in the office, unless you give them a source to where to get them, they're put out into these big box stores, wandering aimlessly through these long aisles. They get confused, they're not sure what to get, and they just get what they would otherwise, or just pick the next thing out rather than really following what you've recommended. So it's so convenient for your patients to just direct them to one setting that they can just have it delivered right to their door, and also to use it for the education and use it for the resources to reach out. I am always available that if an office has a situation or a patient has a situation and they have a question to contact me. Because if I don't know the answer, I will try very hard to find out.
And how do they contact you? What's the best way to contact you?
There is a link on the site, a contact us link, but my email address is jill@sideeffectsupport.com.
And I love your blogs. I mean, you got some really amazing blogs in there. I mean,
thank you.
Very good. I mean, your last one, understanding risk of MRONJ in cancer patients. I mean, this is just some stuff that it's very interesting.
It's fascinating.
It is fascinating.
It's fascinating because I really think we're going to be seeing more cases of the medication-related osteonecrosis of the jaw as dental professionals because of some of these newer targeted therapies that are coming out. So it's pretty important that we're aware of the risks.
I also love your chart on the pH of common substances, battery acid to stomach acid to all the way up to bleach. It's dental erosion is another thing. I remember when I was in school, they still thought the dental erosion was from sawing the toothbrush back and forth, and then they thought it was from occlusion, and then they thought it was from acid and pH, and it's probably from multifactorial from all the above, isn't it?
Yes, And it's something to be aware of also that sometimes the medications that people are being given in an oncology setting are very acidic, or they may contain sugar. So it's good to be aware of what some of those medications are, what the risks may be, and what we can do to help kind of curb the effects from them.
Well, I think you should just do an online C course. I mean, just to cover for the team, because it's one of those things where if a dentist is listening to this podcast, he needs the hygienist to be on board. Everybody has to be on board. And what's scary, what's frightening is when you study a dental office, you know who gets asked the most questions in the entire dental office?
The front desk.
Front desk. And when you give them a prescription, or they got a question, or they got a problem, and they call, they're asking Valerie, who's answering the phone. And then when you go to these dental courses, like I just lectured Saturday in Phoenix, there wasn't any staff. It was a couple hundred doctors, I think 3 hygienists, and that was it. And it's like, why do these people not realize that it's a team approach? And whenever I see a dental office where the dentist, it's just standard where, the whole office goes to CE together, and because he gets it, because they're going to be asking the front desk, you're going to be asking your assistant when you leave the room. Hell, they're in there with the hygienist for an entire hour. I mean, that's most of the dialogue. That if you can't get your staff on board to form informative, educating relationships with your patients on all these issues, it's just not going to get done.
Absolutely. And I think that is one reason I love doing like the in-office education, going in and having a complete staff at one time that can all ask questions. And there may be aspects of the educational part or the technical things that, they may feel is a little bit like they don't understand what that has to do with them. But it really is so important, because they are the first line of making contact with patients. And I always use the example that if they're confirming Mr. Smith's appointment and he says, well, I think I'm going to cancel because I just found out I have cancer and I'm going to be starting treatments in 2 weeks. Unless they're aware of some of the issues that can arise, it would be human nature to say, oh, by all means, call us back when you're feeling better. But they're missing out on a golden opportunity then to instill in that patient the importance of keeping their appointment and making sure that any work that needs to be done is taken care of before they enter into cancer treatment.